Hi there. I'm here with my lovely patient Stacy, and she's going to tell you what procedure we're going to do for her today, and then I'll demonstrate it for you.
So I recently had braces put on and can't wear my night guard anymore. So I have come to Dr. Happy to have some Xeomin injected into my masseter muscle to help relax and prevent headaches and sore mouth and jaw and teeth and just be generally pain-free.
All right, so the way this works, we inject, and then in 2 weeks we're going to do a follow-up appointment. And at that time, if you feel like you are not getting enough relaxation of those muscles, we'll inject a little bit more. We always do this kind of slowly because if we do too high of a dose up front, it feels really weird and you won't like it. You might not be able to chew as effectively, so much better to start low and go slow, and you can always add it in, we can't take it out.
Perfect.
All right, so put your head down. Okay. And can you bite down for me? And relax. And then bite. And relax. Yes, of course. I have a new one for you.
Yes. Oh, you fancy.
Yeah, there you go. This is a vibration device. You've seen me making silly comments about it in the past, but basically it fools your brain into thinking they're not getting needle injections because your brain will focus on the vibration from the device. All right, once again, bite and relax, bite, relax, and relax. You okay?
I'm good.
You have bite? Relax.